The Johnson & Johnson single-dose vaccine is going to soon be on its way across several states, including right here in California.
Eyewitness News reporter Rachel Brown is live in the newsroom with details on the rollout happening right now. Rachel.
Yeah, good morning to you, Leslie and Brandy. The White House says the entire stockpile of the newly approved vaccine began shipping out overnight. That's about 4 million doses. According to Governor Gavin Newsom, California is expecting to receive about 380,000 of those doses this week. That means we could see the first shots in arms of patients as early as tomorrow.
I'm still fairly new to the nursing profession. I've only been a nurse for a few years. When I transitioned to the ICU from progressive care unit, we immediately were taking COVID patients. So this is kind of the normal for me now. I know a lot of other nurses who have been there for 10 to 15 years. They've never seen anything like this, and this has been one of the hardest years to adapt in healthcare. I remember at the beginning there were so many changes occurring and new rules. Every time we came into our shift, we had to adapt. We had to learn to pick up new skills quickly so that we could take care of these patients safely. We used to be able to run into the room if there was something wrong, or if the patient pressed the call light, we could go in right away and check. Now there's so many steps before going into the room that we really need to strategically think about what we are going to do in the room and what else we need to bring just in case we get stuck in there. It feels different than how we're taught to do nursing, because we usually put our patient first and we go to them immediately, but now we have to focus on making sure we're protecting ourselves first. Often people think COVID only attacks the people that aren't healthy and have medical conditions. However, we've had several patients come in that had no past medical history, that were working and have a family, and all of a sudden they can't breathe and they're on a ventilator. It's the hardest thing to watch them go from being able to talk to being completely in a medically induced coma. Something that I hear a lot and also have seen for myself is just these trends of numbers that we've been getting from the CDC and just data from all around the world. And this death rate is under 1%. So I can see why some people, they don't understand why so much has to change when it doesn't seem like their risk of getting it is that high. However, that 1% or less than 1% might mean nothing to one person, but be somebody else's entire life just destroyed. I think it's really important that we keep those people who have been greatly affected by this pandemic in our minds as we continue to make choices in our daily lives, because we never know when that person at the highest risk could be us or our loved ones. The community around us calls us heroes, but I have trouble taking that in often when I'm at the bedside, because it doesn't feel like what we are doing is heroic. It doesn't feel heroic when we can't give our patients the comfort that they want, or we can't let their loved ones in because of visitation rules, or when we zip up a body bag quickly after they die in order to make room for the next person. Even though it's for the safety of our patients and to protect them, it still stirs up a lot of moral distress. I hope if one thing that we've learned is that life is life and health is fragile and something that is really a gift that we get every day. And, I don't want to take it for granted. It's really sad to think that my parents or my grandparents or my siblings could be those patients, and I can't imagine for the family members what it's like to be separated from their loved ones and knowing that they're suffering but not being able to help them. So I just hope that they know that we're doing our best to take care of them and treating them like our own family members.
Hi, this is Deanna. Yeah, I'm the nurse tonight for your family member. Yeah, I'm gonna be here all night till 7:30 a.m. in the morning, so I'll be taking care of them, and we go in about every hour, keeping really close eye on their vital signs. I'd like to set up a Zoom meeting if you want to. We really encourage families to call and see their family members. They might not be able to respond back to you because they have the tube that's helping them breathe right now, and they're on many medications that are keeping them comfortable with the tube in their mouth. So we can still set it up for you and go in the room, and you can talk to them and tell them anything you want, and we can also pass messages on for you as well. So yeah, we'll set it up, and I'll give you the password and the PIN number, and it's pretty straightforward. So okay, all right, sounds good. Okay, thank you. Bye-bye.
Despite our efforts day after day, many of the patients we take care of do not get better. They get weaker, they require more medications, they develop additional infections, they require increased ventilator support and more tubes for fluid to go in and excretions to come out. Even if our patients make it out of the ICU, they don't usually get to go home. They have to go to a long-term acute care, and they still don't get to see their families because of the COVID restrictions. This disease is not one and done. It leaves a lasting physical deficit on these patients that do make it, and we see these things that make a person who they are get taken away on a daily basis. Our patients often stay for months at a time, anywhere from 1 month to 6 months. And when they pass or when they go to another level of care, their beds are replaced within an hour. It's important to remember how far we've come and how much energy we have all put in to adapt to these new changes, and just to appreciate ourselves and each other for making that effort and working together. This year has called us to be resilient. Through all those times that we didn't think we could get up the next day and do the same thing, and for all those times we didn't think we could make it through another 4 weeks of quarantine, we have gotten through it, and I think we can look back and see how resilient we have been. This pandemic really exposed everybody in this world and exposed us to a new virus that our body had not recognized before, as well as exposing us to new levels of discomfort and loss that we've also never experienced before. I hope that time will heal and we can go back to not fearing every day of life, and that we go forward appreciating the things that we do have, as well as continuing to be considerate about the people we share this world with and continue to care for those that we love.